dentist may not be at the top of your to-do list, but it should be, especially if you're taking prescription or over-the-counter medications. They can impact your oral health. And here with her top 10 list of meds that can affect your teeth and gums, welcome back, family and cosmetic dentist, Dr. Terri Alani. All right, Dr. Alani, let's start with dry mouth. The interesting thing is they have medications and things for you to do to take care of dry mouth, but your thought is, let's first figure out what's causing it.
There's a lot of medications in your cabinet that people are prescribed that cause a lot of symptoms for your gums and your teeth. So there are 400 meds that can cause dry mouth.
Wow.
Let's talk about them. A lot of people are taking high blood pressure. That can cause dry mouth. Antihistamines can cause dry mouth. Decongestants can cause dry mouth. Parkinson's medicines for Parkinson's disease can cause dry mouth. So there are a lot of medicines that cause dry mouth. And let's talk about the solution. Okay. The solution would be to, you can either have your dentist prescribe you Biotine, which is an over-the-counter saliva product, or just sip on water throughout the day, chew sugarless gum. You can take remedies like that will help a lot because it can really cause the accumulation of plaque and bacteria in your mouth. And the problem is it can cause more problems with gum disease and cavities.
Tooth decay, yeah. All right. Abnormal bleeding.
Abnormal bleeding. Abnormal bleeding is caused by anticoagulants. It can cause from patients taking aspirin, and you never want to take aspirin and put it directly on your tooth, ever, because that will cause some corrosion of the gum. But basically, there's blood thinners, and we take them for people that have heart issues, but one of the side effects is if you go into your dentist and you're having a deep cleaning or an extraction, it will cause excessive bleeding. So what is the solution? First of all, let your dentist know. A lot of times we can call the physician and ask them if the patient can stay off of that for about 5 days before the procedure. Or if, this is a little tip, if you leave the dentist and you have some excessive bleeding, take a moist tea bag. It's got tannic acid in it. It constricts the blood vessels, and it will help reduce the bleeding.
Ah, great idea. Okay, an altered taste.
Believe it or not, altered taste, one of the medicines that can cause altered taste is ADD medicine. And also there are medicines called Flagyl and then the nicotine patches. That's a tongue twister. Can cause altered taste. So basically just let your dentist know, and a lot of times the physician can change the medicine because it's not real comfortable when you can't really taste your food. It can really change the way it tastes.
Yeah. All right. The soft tissue reactions.
Okay. You can get mouth sores and inflammation from certain medicines, a lot of immunosuppressive agents that people use for transplants. Again, channel blockers for high blood pressure. High blood pressure medications have a lot of side effects, and also oral contraceptives. So the solution is just let your dentist know that you're taking any of these, and they can help find some remedies to help relieve the symptoms.
All right. Enlarged gums, or those inflamed gums.
Enlarged gums are also known as gingival hyperplasia or gingival overgrowth, and this can be caused by epileptic medicines. It can also be caused by calcium channel blockers and, again, immunosuppressive drugs. So basically, if you're having that, you just let your dentist know and go in for frequent cleanings because that's really important to keep that overgrowth under control.
Yeah, this next one, tough situation here because it can lead to, obviously, tooth loss, bone loss.
Exactly. Steroids. Steroids are known to cause bone loss, but the biggest thing are the bisphosphonates that people take, especially women, to prevent osteoporosis. It's really important that you go in for regular cleanings because you can get a symptom called osteonecrosis, and what that does is that actually causes the bone in your jaw to die. Very important to go in for regular cleanings and let your dentist know you're taking these medicines.
Yeah, because that could lead to your teeth just falling out.
And the solution is, of course, is maybe have the medicine changed.
Okay. Increased risk of cavities.
Okay, this is a big one. What do we give our kids when they have a cough? We give them sugared cough drops, right?
Because they're not down in the other
stuff. We give our kids chewable vitamins. They all have sugar. If you look at a vitamin that's chewable, the first ingredient is usually sucrose. So if you can switch to like tablets, you're going to have your kids maybe take their stuff not before bedtime. Try to go with sugar-free cough drops, and also make sure you're brushing with the fluoride toothpaste.
Okay. There are other medications that change the color of your teeth and gums.
We all know what tetracycline does. A lot of people take that for acne. We now know that that can cause discoloration, permanent discoloration of your teeth. And also, if you're pregnant, you do not want to take this drug. And if your child has teeth developing, the solution is, of course, long-term whitening. And then just not taking the drug at all.
Yeah. All right. Thrush. What is thrush?
Thrush are the whitest patchy lesions in your mouth that are a result from overuse of antibiotics. Say you have an infection, your doctor prescribes you antibiotics. What that is going to do is going to kill the antibiotics, so the bacteria, so the fungus grows. And there are ways to control that, and one of them is to prescribe a nice statin solution, and you can give also the patient some lozenges specifically for this, and that will take care of it. But that's what it's caused from.
Okay, and then fatigue or memory impairment.
A lot of patients take psychotropic drugs, and that can impair your memory. It can cause fatigue, and so you might forget to brush. You might forget to clean your teeth.
Something as simple as that,
exactly.
Just not,
So what we recommend, do not get off the drugs unless your physician allows it. But basically, you can set an alarm. You can put yourself reminders, and just really common sense. But what we want to encourage is that you see your dentist regularly and let your dentist know what's in that medicine cabinet.
Right, right.
You know, don't think that just because it might not be important or whatever, but it's important to us. We need to know everything.
It's
exactly.
all connected. All right, Dr. Alani, thank you very much. Dr. Alani has a special offer for Great Day viewers. If you come in